Thank you once again, colleagues, for joining us. And it is indeed a pleasure to welcome you to this launch of one of the innovative solutions that African Society for Laboratory Medicine is bringing on the table as a solution to one of the challenges that we face in the continent as far as provision of laboratory quality services, which is accessibility to external quality assessment programs. Today, we will hear and we will also receive some good news on the program that ASLM has developed in order to provide accessible, affordable solution to provision of external quality assessment, a program that we are calling Afri-EQA. So to let us start right away, we will begin by receiving welcoming remarks from our CEO, Mr. Nqobile Ndlovu from ASLM. Thereafter, Madam Patient Dabula, who leads this program, will introduce Afri-EQA to us, providing an overall overview of what Afri-EQA is, what additional value is it bringing into already existing external quality assessment programs that are there, and also what are some of the timelines and expectations after this launch. From there, we will hear from some of the already existing regional providers of external quality assessment programs and how these also take part and contribute to this regional program. We will hear from Professor Oga from the National Institute of Communicable Disease, South Africa. We'll also hear from AMREF, Mr. Dennis Mwiti. And then, if time allows, we'll also hear from one of the countries who are in the process of coming up with a national external quality assessment program. So without wasting much time, let me take this opportunity to introduce Mr. Nqobile Ndlovu, our Chief Executive Officer for ASLM. Mr. Ndlovu, over to you.
Thank you so much, Dr. Tokmo. Good morning and good afternoon, colleagues. I'm so excited that we are here today launching one of the very most important programs that Africa needs, the Afri-EQA. And ASLM is really excited to be, being part of this journey, really to address one of the challenges that we all are very familiar with as far as quality is concerned. So for ASLM, the areas around quality are very close to our heart. This is the heartbeat of ASLM. We have been supporting quality improvements in the continent since almost like 10 years ago. Our SLIPTA program have been very instrumental in helping laboratories improve their quality, in moving laboratories even towards international accreditation. And one of the things that we have realized that laboratories struggle with for the greater part of trying to implement and execute quality programs is the provision or is the component of external quality assurance. And this has been really a pain point for many of us in our countries, really trying to make sure that our laboratories are progressing on the quality agenda. It has been a pain point for many of us when we are trying to address the issues of accreditation. And we believe that time is now for us as a continent to really begin to understand or begin to leverage some of the capacities within the continent so that we can really provide a sustainable program of EQA panel provision for the continent. So I'm very excited to that today we are going to be having some talks coming from some of our regional EQA providers and also here even from the national programs in some of the countries. This is important when we are talking about sustainability, when we are talking about promoting some of the best products or even best practices around the countries or around Africa. So we are excited that ASLM is launching this very important program so that moving forward, when we are looking at EQA provision, we are looking at a program that is sustainable, that countries can afford, that can be consistently provided, a program that can also create accessibility and also affordability. We know that for the many laboratories, when you talk about EQA schemes, these are very costly, these are very expensive. Some of them have been coming from countries outside the continent. And also, there's a huge gap in the continent in terms of EQA participation. So, and because of that, many laboratories are not participating. And this is a gap that we want to step in as ASLM. We want to step in also together collectively as a continent with other EQA providers that are in the continent. So our program as ASLM really is to, number one, we want to recognize that there are already existing EQA providers in the continent. And ASLM, we want to support, we want to strengthen, we want to equip, we want to collaborate with these existing EQA providers who are going to be speaking to us today. But most importantly, we also want to work with countries really who want to start producing these EQA panels. So as ASLM, we are very proud that there are countries that really have been doing this. We want to strengthen that. We want to support them even towards accreditation. We do have some experts that we can bring to work with the different institutions. So today it is a very big day for us as ASLM and also for the continent, where we really want to make sure that EQA provision moving forward is something that we can sustain. We all know some of the funding challenges that we are facing, given the shifting funding landscape that is happening globally. So as an organization and also as countries, as a continent, we need to start thinking of sustainable approaches. We need to begin to leverage some of the existing capacities that are there in the continent. So today we are very excited that we are starting a program that really is going to make sure that quality is sustainable for many of the laboratories that are really gearing themselves to be implementing quality standards. EQA being one of the areas that we want to focus on today. So thank you so much for coming. I want to appreciate all the presenters that have made time to be part of this launch. So with those words, I want to hand back to you, Dr. Tokmo. Thank you.
Thank you very much, Mr. Ndlovu. Sustainability, accessibility, and affordability are the keywords that Mr. Ndlovu said to us. And this is how Afri-EQA would like to contribute to what he calls a pain point when it comes to assuring the quality of our laboratory testing in the continent. I think most importantly, you speak about leveraging of existing capacities that we have built over the years through many projects at ASLM, through other interventions outside of ASLM in the continent. And as you rightfully say, there are already existing players, there are already existing regional, national EQA providers. And as ASLM, we would like to galvanize all these capacities so that we can make EQA much more accessible, affordable, as well as sustainable. So to take us through and introduce us to Afri-EQA is Ms. Patience Dabula, who is a program manager at the African Society for Laboratory Medicine, and who has led the process of initially conducting a business feasibility plan, just for us to understand that this brilliant and good idea we have, is this something that can be sustainable? Following the development of that business plan, she then led the development of the framework for Afri-EQA and how this will be implemented in the continent. Ladies and gentlemen, I have the pleasure of introducing to you Madam Patience Dabula, who is going to take us through an overview of the Afri-EQA program. Over to you, Patience, and thank you.
Okay. Thank you very much. Good afternoon, everyone. We are excited today, as management indicated, that we are launching Afri-EQA, a solution to our continent for external quality assessment. As ASLM, our vision is a healthier Africa through access to quality laboratory services. And these services are then offered by measuring EQA. Our goal is to advance the laboratory profession, practice, science and network, and Afri-EQA is coming in to continue to do that. Please visit our ASLM website for more information about ASLM. Our technical areas where we are competent and we are offering different services, they start with laboratory networks, workforce development, quality and accreditation, and under quality, this is where Afri-EQA is now coming in. ASLM does a lot of work on regulations, data and communications as well through many programs that ASLM is offering. ASLM has then decided that we are establishing a regional EQA program called Afri-EQA with the aim of providing African laboratories access to high quality EQA programs. We seek to improve quality of laboratory testing across the continent through provision of, in addition to high quality, we're looking at low cost EQA programs across One Health spectrum. We're establishing this as a program under the oversight of ASLM management, and this will enable Afri-EQA to benefit from ASLM broader portfolio, staff, resources, infrastructure, and what you already know this brand of ASLM to be doing. But why Afri-EQA? Since we all know that we have a lot of EQA providers in the continent. Participation in EQA in the continent is not ideal. We know that many laboratories do not participate. ASLM wants to then manage this and encourage participants through various ways that I will explain. We have national EQA providers that do not offer a lot of EQA schemes in the countries. We want to equip countries to be able to produce more schemes than what they are offering, and by partnering with them. Some countries do not have EQA providers. As a result, they are always paying even shipping costs for schemes that are basic, and they have capacity, want to do that, don't know where to start. We will then, as ASLM, come in as Afri-EQA to work with them. And we have cases where we then have outbreaks and we are challenged with schemes that are not available. ASLM has even in the past been instrumental in introducing schemes like even with COVID mpox, we moved quickly to do that. We have EQA providers in the continent that are not accredited. It's quality. We are offering EQA support for accreditation for the providers, and we have EQA staff members that are not really trained in EQA. We want to offer EQA practitioners that work. Our key focus is 3. We're looking at EQA projects where we want to attract funders that work in objectives that are similar to what we are doing in the region to partner with us to be able to improve the work that is being done, but also to work as well with us. EQA programs want to increase participation by partnering also with IVD suppliers, advocating country supports and increasing awareness. We want to provide EQA programs to laboratories by giving access then to different countries or providers to material that they normally would not have if they were working alone. And we're looking at EQA, third-party EQA providers to be able to assist us with work that the current Afri-EQA partners are not able to work. We continue also with providers. We want to do a lot of things. We're looking at capacity building for national and regional level to be able to train EQA, then practitioners through TRICAP that I will explain. We want to identify, evaluate capacity for local providers to be able to assist them with technical assistance. We also want to look at national reference laboratories that are providing schemes and help them. We want to also empower EQA providers with accreditation for 17043 through the SEPTA program that I will explain, and it will include technical assistance and audits. So what is TRICAP that I mentioned? So ASLM has a training and certification program for EQA providers. Our pilot workshop is today. This week is standardized program to formally recognize EQA practitioners in the African continent. We're looking at a 3-level certification program. At level 1, it's fundamentals of EQA for all the laboratories or participants in EQA. And the next 2 levels are looking at EQA practitioners, and the experts will be at level 3. It is delivered in 3 modules, really. The first one is online self-paced learning through the ASLM Learning Academy. We've already completed the first level training with participants this week. They started online. Then the next one will be workshop-based, face-to-face, 5-day that we are doing now, and it will be followed by hands-on practical so that the countries are able to benefit. The next step is the SEPTA, which is stepwise improvement of EQA providers towards accreditation, where we're assisting them for ISO 17043. ASLM has already developed an ISO 17043 checklist. We have already gone in 6 countries, audited 7 EQA providers, including our consortium partners as well. And we are looking at it as a 5-star level, similar to what you know with SLIPTA. We are also clear that on the left-hand side, we want to help the EQA providers to also produce EQA. So they will go to step 1, 2, and 3, depending on the type of work that they are doing, because we understand that they cannot just immediately from the beginning be able to start producing and doing a lot. So we will take them through stepwise processes of providing EQA, depending on what the needs are in different countries, until they're able to be fully fledged independent EQA providers working with different partners. Our experience in EQA is in provision and training, and also partnering with different providers all over the world. The latest on the top left is mpox, sequencing and bioinformatics, that we are starting now through Afri-EQA, already using the ASLM in EQA information management system through a partner that is then helping us to produce. And we have done work on HIV viral load, EID, in 27 countries, mpox, PCR as well, with 16 countries, SARS-CoV-2, both PCR and sequencing, and Afri-EQA on AMR. This is some of the work that ASLM has done on EQA. We have learned a lot through those processes, and we're taking all this ability, network, and experience into an Afri-EQA model. How will the model work? We're looking at regional partners, we're looking at distributors, we're looking at technical support all over the continent to partner with us as ASLM. It will be managed and headed through our ASLM team. You can come and partner with us. Say, let's start on the left, just to produce panel. You may not be able to ship and do a lot of work, and then we will then link you with the other countries that are starting EQA to do the work. In the middle, you may be one of those that are, your provision includes distribution of different EQA in different countries. We will partner with you as well. You may be also one that is able to then provide technical support and lead and equip others. At the regional level, we'll partner with you as well. But at the bottom, we also then want to look at national EQA providers. How is distribution done? If you are in a country, you don't know where to start, where will you source your material? We'll partner with you through some of the regional providers that will then work with you to ensure that you produce. You will then also are looking at full EQA providers to receive until the end and produce report. And then nationally, if there are also technical support that is needed, we will work with you at this. So Afri-EQA is not really an EQA provider, it's a solution to EQA provision in the continent. So we will work as I indicated with different providers. So some of the work that we'll do will be influenced mainly like all the other ASLM projects with what the funders are looking for. They may then say specifically, these are the countries I want to work with, this is the scheme we want, this is the provider we want you to work with. We will respond to that. Top right, country EQA samples, export and import permits. So as we are going to engage partners, we are clearly going to look at some of these regulations and the hindrances and the challenges that we know exist in EQA. If samples can't move easily, we may not respond nicely, but we will then look at all the shipping requirements, what you are able to do, and also take it from there. At the bottom left, we'll also look at our existing partners, the EQA providers that have already worked with ASLM inside the continent, if they're able to take more, because capacity is also important for us to decide how far we want to go. We'll look at those limitations or those strengths that allow us to expand the work and be able to do more work with existing ones, but also this will also assist us to identify additional providers that we work with. The fact that we have worked with a provider before at ASLM in a grant doesn't automatically mean that the provider will be there. They have added advantage. We have done some work. Some cases we have capacity build and we will continue doing the work. But the process of a continuous monitoring on performances is important to us as ASLM because our brand is that we want them to be able to deliver and offer solutions to the different countries. We will also hear from the participants from different countries, bodies, and ministries what their needs are. And as ASLM, we will also need. And I'm again emphasizing the fact that Afri-EQA is not an EQA provider only, but a solution to EQA in the continent. We will follow our normal selection processes within ASLM through procurement to really identify who are our providers. We will screen, there will be specifications. We will identify the potential suppliers depending on where work is. We will also then establish different criteria, identify risk, evaluate, negotiate the terms, and see if really we agree on the terms. So you may then be okay, but if we are not agreeing on that, it may be difficult for us to finalize the agreement. So all those processes will then be done with the ASLM management team and core staff that are working, and we have a team that works with sub-recipients and subcontractors as well. So those will be the normal ASLM processes that come in addition to Afri-EQA then giving a checklist or a selection criteria that's QA then specific to be able to need that and with IT requirements. So with the ASLM IT team already managing Afri-EQA for some of the schemes, we are not limiting the work going forward to that, but we are just saying to you that if you know that you want to partner with us, but you don't have an EQA IMS, don't be discouraged. We are available and we will be able then to work with you as well. We'll create a list of different EQA providers that are available depending on what is it that they want to do. Full EQA provision, sample preparation, EQA trainers, those that are already existing and shipping capacities. I want to spend more time on EQA train us. So with our aim of then expanding this work, we want those of you that are already experienced, have ability to train and are willing to build capacity and work with us without giving us limitations, then to come and do the work. If you know that you don't want then to share information, you don't want to train, we may not be willing to work with you, because our main idea is to capacity build. We want you to work with facilities. We are going to check experience and work with everyone to improve really all the work across the spectrum in the continent. There will be implementation steps that are followed by ASLM through different projects, and whether a funder comes straight as a normal ASLM project that have EQA, those processes will be followed by our team. And if it's something that's totally new and Afri-EQA only, then the processes will then be different. But we will still work with providers that we have worked with before, and we are opening this up as well to working with new partners that want to work with us as ASLM on this. So we have now launched Afri-EQA following the work that has been done, and I'm grateful to everyone that has been working with us to get to this stage. Early next year in the first quarter, we will immediately, as ASLM, are able to come in and do the ISO 17043 training. We have auditors that we have trained as Afri-EQA through that are French and English speaking. We are looking to train more to cover Portuguese and other languages, where we will then finalize and review our selection processes. We are immediately able to train EQA practitioners because we are piloting the process now. We will improve early in the year and be able to send it out and train depending on the demand that's coming. We'll receive then capacity building from providers as well, because we will use this period to be able to build our bigger infrastructure while we have the immediate things that we are able to need. The audits will still continue throughout, and then in the second quarter, we will then send out communication on the services that we need. Should we get a funder that wants EQA provision before the second quarter, we will reach out and advertise and say who's available to work with us. But other than that, our plan is then to wait. We don't want to limit what's coming, but we also then are sure that we then want to limit the implementation of the process. As you can imagine, we are dealing with a lot of things at the same time. We will then link also with AFREC as well, because we know that our accreditation of 17043 in the continent is not a lot, but that also affects the 15189 17025 as well, of which 17043 accreditation is important for those laboratories as well. So come quarter 3, we'll continue training the providers, and we'll start really looking at the mentorship program for EQA providers and how do we then do that work while the other work will continue during this period. We had an example of MPOX that we have then implemented, and it was done with Africa CDC. And I'm not going to spend a lot of time then going into the detail because of the fact that I think we have already given the example, but I also want to take this opportunity to acknowledge Africa CDC for the work that they have done with NHLS to get MPOX running. I'm using this opportunity also to thank our funders, Fleming Fund, that has really assisted ASLM to be able to work on the business development for Afri-EQA, assisted them on TreeCap, assisted ASLM to have SEPTA with training of auditors and going into countries. I'm acknowledging ASLM management for the opportunity and the work really to serve in this portfolio. The consortium partners that have done the work really and covered many countries. We'll hear from them, technical advisory committee members, consultants, Fleming Fund, staff members, and other colleagues at large in ASLM and participating countries and laboratories. Please, we will from January say contact us on Afri-EQA. I know I'm talking about it today and I can't say don't contact us, but if you take into consideration our map, this is our email address. You can contact us and we will see how to then guide you through our plan. I also want to thank everyone that has joined us today for your attention. Thank you, Dr. Tokmo. Over to you.
Thank you very much, Patience. Wow, what an innovative solution to what Mr. Ndlovu in his opening remarks called a pain point when it comes to provision of external quality assessments. Thank you for taking us through why we need this solution at this particular time when issues around funding are actually on the decline, and we are being called upon to think outside the box so that we can continue to provide quality results and checking our systems using EQA. I also like the fact that in the Afri-EQA, it's not only about providing accessible external quality assessment materials, but also training and capacity building. So training the practitioners, and you've laid out the training and certification program for external quality assessment practitioners, which we look forward to, again, its official launch, hopefully before the end of the year. You also spoke about how at this particular time, we may not all have the capacity that we need to have to be able to provide the full spectrum of EQA. And within Afri-EQA, you've laid out how you can even assist countries to build that capacity until they reach levels where they are able to provide the EQA. So it essentially means everyone is welcome at each way. If you have that ambition, that desire to become an EQA provider at some point, you can join this program and grow along the levels that Patience has mentioned in the what she calls the SEPTA program, where there's incremental progress towards even ISO 17443. The big question that I'm seeing in the chat box is, how can we join? How can we join? How can we join? So Patience, I'm not sure whether people are willing to wait until next year. They would like to join right now. But we have really outlined the steps that we need, the processes that are being put in place, and everything will fall in place early next year. But inquiries are open. You can send your inquiries to the emails that are shown. But I think she has really outlined that as providers, there will be a selection process. So a call will be made where you can submit your expression of interest to join Afri-EQA, and then the steps that Patience is outlined will be followed as a screening process. Also for practitioners, you will be able also to enroll into the training programs that she has mentioned, which has got 3 levels, from level 1 up to level 3. So I think it's out there. Thank you very much, Patience, for taking us through this very important solution to provision of external quality assessment for us here in Africa, where issues of resource mobilization are challenging. So we would like to hear from some of the existing regional EQA providers that ASLM has been working with in the last 4 or 5 years. Like Patience has said, and also our CEO in his opening remarks, we want to build on a already existing capacity. We don't want to start from scratch because it's not necessary. We already have institutions, we already have national programs that have been providing and supporting us with provision of EQA. The very first place we'd like to start is at NICD, which most of you in your countries have been working with in provision of EQA before COVID, during COVID, and even now in some of the outbreaks that Patience has mentioned. Prof. Ogam, I would like to welcome you in the next 10 minutes to be concise and then give us an update of some of the work that NICD has been doing and what contribution do you look forward to having in Afri-EQA. Prof, over to
you. Thank you. This is a great opportunity to applaud ASLM for this initiative, and also opportunity for everyone to understand what we are doing and how we engage in all this program. So, right, great. So we started actually with ASLM in 2019. We initiate pilot in 2020, and from them we channel it until 2025. That's a long time to really address the importance of EQA programs. Then we have our own experience, and NICD also will propose some capacity and future EQA provisions. So this consortium partner, not only with ASLM, but with IPD and AMREF, have performed activity to improve the quality of laboratory bacteriology diagnostic for AMI. Remember, to everyone, patients mentioned so many EQA programs, but now I'm concentrating on bacteriology diagnostics and AMR provision. The project that been designed is One Health AMR approach, which included work on the human, animal, and environmental health. So what our experience actually been vast, because we look at the strengthening of EQA panels based on the country needs, development of the laboratories, EQA distribution in those laboratories, in reference laboratories in those countries that need it, and they've been supported by funders. Then we also been involved in the training of laboratory personnel to provide support for corrective actions. So obviously we insisted for implementation of quality management system, for laboratory improvement in those areas where we've been implementing this program. We also tried to build capacity at the National Public Health Laboratories to conduct some of those programs, and we insisted on the capacity building, also indicating what laboratory infrastructure, equipment, system need to be in place. We started from the basic macrobiology. We can't skip that. We still need to do phenotypic testing for AST, and we also indicating possibility and needs in a special situation for genomic and sequencing analysis in a specific channels. And with that genomic sequencing, we obviously look at not anymore just for the EQA program, but for the program that also Africa CDC been initiating over time. So how we began and where we ended. So human resource training for providers been the first step when we started building capacity for other EQA provider like IPD, Institute Pasteur, and AMREF from Kenya to produce and to be able to become really respectful the providers in bacteriology with specific accent on AMR. So we also introduced and we also developed some business model how to, over this time, how to make this possible, because not only the complexity of bacteriology and looking for AST is more than any other programs that we are looking at, just the shipment and just the conditions, regulations, and so on, makes this program much more difficult and different and challenging than any other. Obviously, when we talk about that, we also thinking about data. We want those data to be reportable, to be representative, to be accurate, and to be something that we can use for policy, the stewardship, clinical guidelines, practices, and obviously for antimicrobial stewardship with obviously the public health sustainable development and possibility for improvement. This is just an example for this laboratory provision and training program that we provide over time. We just had once a week, but usually our the last one, what we have is the specific country requirement. It's a 2 weeks program, hands-on, with lots of interactions with the both side provider and participant. Obviously, there are challenges. We still need to ensure that all laboratories can participate and benefit to keep up with quality, evolving technology, also learning from recent implementations, and most importantly, just to continue with all this improvement in laboratory capacity. So not only that we done this program EQ Africa, we also been recognized, and since 2002 that we've been providing EQA program for African region at the beginning. Then we expanded that to global African regions. Then we moved to back to, in 2018, to specific bacteriology program for AMR, for African region, public health laboratories selected for MMR reference activities. So that is something really being embedded in NICD structure and capacity to provide to others. This is just an example from one of publication how we look at our data, how we use those data, that you see how performance in AST is poorly done, and we reworded our program to address AST rather, or to get the AMR report better than ever. And we changed our program, emphasize our AMR, and start to introduce more innovative approaches. Not only that, in last year, 2024, we had the ISO training. You can recognize many of the participants from today, from discussions that been indeed very helpful and supportive to make this training possible. We also had a baseline audit in March this year at the NICD with the team that we been supported and being supportive in this development of this program. And in the nutshell, NICD perspective is to offer consolidated, unified, and focused program for Africa and reflect preparedness to improve laboratories' capacities and surveillance for AMR. So how we can do that? Obviously, I do believe that we have to think forward, that we have to think in what module and what innovation we could embed it in that new initiative. And first thing, what everyone is now talking about is integration of this program in AI-driven possibility to divert, to analyze, and to make EQA more accessible, particularly regarding certain challenges like shipment, but also on other token, very importantly, to have also improving the IT facilities, electrical supply in those countries that they want to complementing this module. Digital EQA, which is slightly different from this remote, it is embedded in AI, but it can be set up in case scenario, microscopy images, raw data, interpretation, with no physical samples. So I think we addressed the issue about shipment physical samples. So this can also revoke an option for more the cost-effective EQA programs. Then we can also look at online tools for AST, where we can make those interpretation based on guidelines that participants perform and look at the whole process. In a nutshell,
yes, if you can wind down, thank you.
Yes, just a second. And then obviously continuation is very important in this the whole program. And very importantly, we also emphasize on delivering of the training and mentorship programs. Monitoring of EQA and the monitoring of evaluation of the whole this process is important. And we also try to conduct this EQA to the elevated level, to the first national, but then also regional and continental for support in the future. And with that, I want to acknowledge Africa CDC, Fleming Fund, Mott MacDonald, ASLM, IPD, AMREF, DTU, and ICD team. These are all our details, and really thank you for this opportunity. And with that, I will stop sharing and close some sort of the feedback from this program that we've been running. Over to you.
Thank you very much, Prof. We really appreciate the work that NICD has done in the continent. I'm sure most of the participants that are here will testify to the contribution that NICD has done when it comes to provision of EQA in the continent. You have mentioned that we have been working with ASLM as far back as 2019, and with countries even well before that when it comes to microbiology testing as well as AMR EQA. And you really outlined the three core pillars of your approach, which first is provision of the EQA materials, training and capacity building of those that are conducting the EQA. And then lastly, you really emphasized on building capacity of other regional EQA providers as well as national providers, which really aligns very well with patient's previous presentation in terms of approach. So thank you very much, Prof. And we look forward to continued working with you in this. So at this time, let me quickly invite Dennis Mwiti from AMREF to also take us through the work they do. Dennis, over to you.
Thank you very much, Dr. Tokmo. Great pleasure to be here today. My name is Dennis Mwiti. I work with AMREF Health Africa as an EQA scheme manager for the currently ongoing EQA Africa Bacteriology Proficiency Testing Scheme, and also our own scheme, which I will be speaking to. I will stop my video so that I can quickly share my slides. Okay. So I'll just quickly do an introduction of AMREF Health Africa. It is headquartered in Nairobi, Kenya, and was founded in 1985 with the aim of delivering health services to remote communities. Currently, the organization has grown to be the largest Africa-based non-profit international health NGO, delivering health services and training to over 30 million people annually in 35 countries. Our vision is to create lasting health change in Africa. We do have 3 subsidiaries, that is the AMREF Flying Doctors, AMREF, the NGO itself, and we do also have an international university in Nairobi. That's the AMREF International University. Our experience working with ASLM, a major partner for us, especially in the EQA space, is that we do have a regional laboratory program that has been involved in lab strengthening activities since 1985. The regional lab program has also been operating EQA programs since 2010 through the East Africa Regional External Quality Assessment Scheme. We were selected by ASLM as one of 3 EQA centers to implement an AMR bacteriology PT program of EQA Africa across the African continent. And this was based on our experience operating a regional ISO-accredited EQA program. This provided us with an opportunity to also expand our scope to include bacteriology. How the roadmap looked like, for those that might be curious, how did we come from being selected all the way to being a fully fledged provider? Capacity building did follow after we were selected, and this included personnel training, equipment, and also infrastructure enhancements to our laboratory in Nairobi. We were trained on bacteriology EQA provision, and this was done for 2 key staff, courtesy of Dr. Olga and team at NICD CHAM. This was an 8-day training in around August 2022. After that, there was progressive handover of PT material preparation, data analysis, and report preparation, with full operations from the end of 2022. After that, we have scaled up operations, including also onboarding additional participants from new countries as well. Some of the milestones we have achieved is we did undertake some training and certification, the main one being the capacity building at NICD, but also IATA transportation certification, ISO 17043 2023, that is for both personnel, and also taking our laboratory to that extra accreditation level of the new version of the standard. Risk management trainings were also done, and also training on the information management system. After that, we did embark on panel production, including commissioning equipment and infrastructure and training of the relevant equipment. And we now do produce all the isolates that we use for our PT cycles, especially for the bacteriology program. There is a continuous production process improvement that we always do undertake. The operations bit is also something that we have now fully, we are now fully fledged in. That is enrollment and orientation of participants. We have done 8 complete cycles. We also do capacity building of personnel through echo sessions. We've also been involved in the capacity building of country EQA programs and other providers in the region. So EQA Africa was launched in 2021. We currently have 6 participating countries. That is up from 4 in cycle 1. We now are serving 118 laboratories, up from 51 in cycle 1. As I mentioned, we completed 1 pilot and 8 cycles. This is just a map showing the coverage of the facilities or the countries, and in red is the regions or the countries that Amref Health Africa is involved in. We do have 89 human health laboratories, 26 animal health laboratories, and 3 food safety and environment laboratories. Some of the challenges during the rollout process and how they were addressed. We initially did have a challenge with isolate stability, and we adopted new methods of panel preparation, specifically lyophilization, and we also did an enhancement to our stability testing processes. Logistics is a major part of EQA provision, and we did face some challenges with logistics and transport, and these were handled by sort of coordinating better with the country recipients and also with the courier providers. Advancing towards that level where you also have an additional scope, that is bacteriology, into your scope of accreditation is also was also an interesting challenge for us. But we did that by harmonizing some of our procedures, enhancing our internal audit processes, and training additional personnel. The utilization of participants of the information of the informatics system was also on and off, and especially because of high staff turnover. But we did manage to tackle this by frequently retraining personnel. Reduced capacity for corrective action by participants. We find that participants do receive EQA reports, but they do have a bit of challenge in turning this into improvement projects. We now are working with in-country subject matter experts, and we also do more in-depth engagement sessions. A few more challenges were staffing levels and also the enhancement that was required to be done on the informatics system to automate some of the processes. I'd like to speak briefly about what I mentioned as the East Africa Regional External Quality Assessment Program, which is an external quality assessment program for primary healthcare. And it is integrated and focuses on commonly performed laboratory tests. We do serve both public, private, and faith-based health facilities. We submit 7 panel materials twice a year, and the list is there. I shall share more details in the chat for those that will be interested. The first 4 materials in that list are submitted in every survey, and all materials are prepared at our laboratory. We say that this scheme is integrated because it not only looks at the practical aspects, but we also do have theory questions, and we also have questions for the clinicians and also for public health practitioners. The scheme costs $200 per facility per year, but this is excluding shipping costs, and we do provide immediate feedback reports and also more detailed reports that cover performance in the entire region. Again, I will share the brochures in the chat and you can have more details on that. Currently, we are serving 10 countries with a total of 41 participating laboratories, and these countries include both English-speaking and French-speaking countries. We also do have a standalone malaria EQA program that addresses detection of malaria parasites, differentiation of Plasmodium species, and malaria parasite density quantification. And this is supported by our WHO validated malaria slide bank that has over 30,000 characterized blood slides. Additional information about some of the work that we do at the AMREF Regional Laboratory Program. We do offer several laboratory refresher courses, including WHO certifications. Again, we'll provide more details on this in the chat. Like I mentioned, we also do capacity building for other EQA providers, and we have been involved in partnership with ASLM to do this. We've been involved also in the evaluation of new diagnostic devices, and we do have additional capacity to onboard more participants into our EQA programs and more countries as at that. We would like to sincerely acknowledge the funding agencies for making this endeavor possible. UKAID, the Fleming Fund. We'd like to deeply appreciate the ASLM leadership team and ASLM at large for the continued partnership, the consortium partners, in-country grant recipients, and ministries of health, all participants that have really actively participated in our program, accreditation bodies, and also the AMREF Health Africa leadership for their continued support. I would like to end it at that, Dr. Tokmo, and hand it over back to you. I thank you very much.
Thank you very much, Dennis. And yes, indeed, we join you in acknowledging the management at AMREF Health for partnering with many of the countries that you have shown, the programs that you have shown in East Africa and beyond, and most importantly, for working with ASLM in the last 3 to 4 years in strengthening EQA provision in Africa. You really outlined, I think we'd like to congratulate you for the continued sustenance of accreditation for your EQA schemes, which is very important and will serve as exemplary to what Afri-EQA would like to do to many of the EQA providers that are there and even national programs. So your experience will come very handy in the arms where we are doing training and capacity building, experience sharing, and so forth. So we really appreciate that. And thank you for outlining the challenges. It looks nice and promising, but good work and good things is always associated with the challenges. And I always say, if there are no challenges, then there's no life. And we are happy that you also met these challenges with equal strength. And thank you for sharing some of the ways you have implemented to circumvent this challenge, which will be a learning curve for those that will be joining this program. So thank you very much. And ladies and gentlemen, I think these two, NICD and AMREF, are exemplary to what we are talking about. Capacity already exists in the region. The expertise is already there. What we need to do is to galvanize ourselves and work together to make sure that we expand this access. We make EQA even more accessible and affordable, particularly in this environment where we are challenged with sustainability. So, Prof. Dennis, thank you very much. And please visit the chat and answer some of the questions that may be directed to you. So at this time, very quickly, I would like to invite Mr. Edwin Chitandale from the Public Health Institute of Malawi to share their experience as a national level provider of EQA. Mr. Edwin, over to you.
Thank you so much. So I'm presenting on behalf of the Deputy Director of Public Health Institute of Malawi, Mr. Joseph Bitrinho Bango. So for the Public Health Institute of Malawi, it oversees the lab quality assurance activities in Malawi. And through that, we have a national quality assurance program, which provides proficiency testing panels, does performance evaluations, and corrective action implementation for both public and private laboratories. So it ensures alignment with regional and international quality standards, including the ISO 17043 2023. Over this year and the last year, 2024, and before that, we have worked with ASLM in strengthening the technical capacity of the Public Health Institute of Malawi through the Public Health Quality Assurance Program, through trainings, so that the personnel involved in the proficiency testing, designing, planning, and production of PT panels, they know requirements. And also, we were privileged that through ASLM, we were audited across the 12 PT schemes to ascertain our readiness for ISO IEC 17043 2023 accreditation. And through the EQA Africa, which is also through ASLM, there has been capacitation in bacteriology technical competency, the provision of isolates for PT panels, and also for competency of the personnel working across bacteriology labs in diagnosis of AMR. So as we have been working with ASLM through particular aspects, these are the possible future collaborations through the ASLM Afri-EQA regional harmonization of PD programs. So participating in development and implementation of EQA PD panels for priority diseases in Africa. Currently, we are working with ASLM on Mpox PD panels to ensure that quality is assured in diagnosis of Mpox across Malawi. And also within ourselves, we have 12 PT schemes across different scopes, from microbiology, serology, molecular biology, hematology. So as a country, we would also like to collaborate with ASLM where there is need that for production of PT panels for emerging or priority diseases. Joint capacity building, implement trainings and the mentorships on design and production, quality management and statistical evaluation. As I have highlighted that personnel from Public Health Institute of Malawi, our PT scheme managers have participated in ISO 17043 trainings, but also we have participated in the development of the checklist for audits for ISO 17043. So that also adds to the technical exchange programs as PT production, designing and planning of PT schemes, it's something which is developing in our country in line with the required quality management systems. So expert attachments from ASLM, peer reviews, and even exchange programs from our facility to other facilities which ASLM is collaborating with, who capacitate us to ensure that we enhance our EQA program. One of the things which is a challenge is data management. As with our PT program currently, we are using the manual-based. So this would be an opportunity for collaboration for digital EQA platforms, which can be integrated to the national laboratory information management systems, so that the laboratories can submit results and also review results online. And then preparedness and response, as highlighted earlier, joint EQA initiatives for outbreak-prone diseases and pandemic preparedness under One Health framework. As a country, also, there are initiatives to capacitate the animal health and also the environmental health lab, which will also require PT panels for continuous monitoring of their pre-analytical, analytical, and post-analytical process. So as you can see, this in the pictures, they are part of the Public Health Institute of Malawi, attending trainings with ASLM, and also doing collaborative initiatives with ASLM on development of audit checklist for ISO 17043. So as a National Public Health Quality Assurance Program at Public Health Institute of Malawi, we are operating under the National Public Health Laboratory, and we are managing multiple national PT schemes, which we successfully piloted at the end of 2024. And then currently we are doing PT cycles for the 2025 to 2026. We are covering microbiology, cryptococcal antigen, and bacteriology, culture, and antimicrobial susceptibility testing, hematology, cell morphology on peripheral blood smears, and then serology, HIV, syphilis, and hepatitis B surface antigen, mycobacteriology, TB microscopy, TB LF-LAM, and MTB gene expert, and then parasitology, blood parasites. And then on molecular biology, we are doing HIV, RNA, viral load, both dry blood specimen and DTS, and also we are doing DBS for HIV, DNA, EID. So we have an established system with appropriate documentation for ISO/IEC 17043, as witnessed through the external assessment which we had from ASLM, and we are currently applying for accreditation. The first process which we are doing is to complete the application forms for documental review. And as I have highlighted, we are able now to support both public and private laboratories with regular PT cycle and performance reporting. So this is just a summary of enrolled participants for the 2025 to 2026. TB microscopy, we have 200 participants. MTB gene expert, 150 participants. TB LF-LAM, 112 participants. Cell morphology, 44 participants. Blood parasites, 93 participants. And then for HIV, hepatitis B surface antigen, and syphilis rapid, 100 participants. Cryptococcal antigen test, 100 participants. Bacteriology culture and antimicrobial susceptibility testing, 26. And then HIV, RNA, viral load, 36. And HIV, DNA, EID, 62. Despite these strides which we have made, we still have challenges, logistical challenges with the local courier system, and also supplies for production of the panels. Despite these significant numbers which we have enrolled, but there are still a lot of labs which would like to be enrolled in these respective schemes, but we are limited with the resources currently at hand. But despite that, also we have strides like for the MTB Gene Expert, we have managed now to cover 100% of our labs, and then we have been able to teeth from the CDC Atlanta supported MTB Gene Expert to a locally provided PT scheme. So we are able to cope on our own as CDC Atlanta is winding up its activities to supporting us in the monitoring of accuracy in the test of MTB Gene Expert. So that's the update on behalf of the Deputy Director from Public Health Institute of Malawi, Mr. Joseph Bitrinya Bango. Thank you, Dr. Tokma.
Thank you very much, Mr. Edwin, and congratulations, firstly, for taking a bold step towards ISO 17043 accreditation for your PT schemes. And the slide that you showed second from last is very impressive in terms of the numbers that you've been able to enroll into your program. And this is testimony of, once again, that we do have the capacity. We have heard from regional institutions, now even at national level, through the Public Health Institute of Malawi. So congratulations, and for also highlighting some of the collaboration we have had with ASLM in the provision of EQA, the support that you received in training and capacity building, and also some of the audits that the team from ASLM has been assisting the Public Health Institute of Malawi, particularly as it helps you towards preparation for ISO accreditation. So congratulations and thank you. So as we wind down, I would like to invite our communication team to run a very short video, after which we'll hear from our CEO to officially launch Afri-EQA as well as close our meeting. David, over to you.
Today, I'm excited to introduce to you Afri-EQA, our very own regional program that provides external quality assessment programs within the African continent. The vision and mission of ASLM is to strengthen local and regional stakeholders in the provision of quality laboratory services. And Afri-EQA is specifically designed for that, because through Afri-EQA, we will be able to, one, provide accessible external quality assessment scheme. Secondly, provide the opportunity to do training and capacity building of EQA practitioners. And then thirdly, be able to support countries that are developing national external quality assessment programs. Besides ensuring that there's access to affordable external quality assessment programs, Afri-EQA will ensure that it supports our countries and our laboratories to measure the quality of their testing processes. This then guarantees the quality of the results, the quality of the information that we get, for us to be able to assist our clinicians provide the accurate treatment and also information for our policymakers. As ASLM, our core is we need to ensure that there is access to affordable external quality assessment programs. Afri-EQA is the right place to be, because with Afri-EQA, this is a local and regional EQA scheme that all of us, if we buy into it, will be able to provide EQA at an affordable price.
Wow. Thank you very much to the team for that wonderful, I think, short clip introducing EQA. At this time, let me introduce Mr. Ngobile Ndlovu, our CEO, to officially declare the launch of Afri-EQA and also close our meeting. Over to you, Mr. Ngobile.
Thank you so much, colleagues. I really want to appreciate the speakers today from NICD, and also I want to thank our speakers from AMREF and from Malawi that really have demonstrated that as a continent we can do this. So Afri-EQA is a solution to make sure that we have accessible, we have affordable and sustainable EQA programs programs that we are able to scale up in the continent, that we are able to improve the participation of many laboratories in EQA programs. This is an exciting program because it also addresses some of the key issues that as a continent are being discussed around health security and also around local manufacturing agenda. It demonstrates that as ASLM, we are developing programs that really recognize the capacities that is there in our countries, as we have heard from local and regional partners that are actually manufacturing some of these EQA panels. So we don't need to look very far. As a continent, we do have the capacity and the expertise. So really, with those words, I want to declare that the Afri-EQA program is hereby officially launched. And I also want to thank everyone for attending this meeting, and also thank our partners that have really been working with us to make sure that we are able to provide sustainable programs for EQA. So thank you so much, and back to you, Dr. Tokmo.
Thank you very much, Witsalovu, and congratulations to the ASLM team. Congratulations, patients. Congratulations to our regional providers, national providers, and all stakeholders. Now we have our own regional EQA scheme. Kudos, and this is the Africa that we want. Thank you, and enjoy the rest of the day.